Hello friends, in this video I'm going to discuss some parameters for diabetes, including the numbers that are considered diabetic or pre-diabetic or normal. So first we start with the normal level of blood sugar. For fasting blood glucose, it has to be less than 100 milligram per deciliter. For postprandial blood glucose, or after 2 hours after you eat, for numbers to be normal, we look for something less than 140 milligram per deciliter. Now these are for normal. In terms of A1C, which is a 3-month average of blood sugar in hemoglobin A1C, for to be considered normal, it has to be less or equal to 5.6%. That's in terms of A1C. Now, if the A1C is between 5.7 to 6.4, that's considered prediabetes. And if it's greater than 6.4, that's considered diabetes. So these are the numbers for normal and pre-diabetes as well as diabetes. Now we're going to discuss the reason that we have type 1, type 2 diabetes. So type 1 diabetes, this is an autoimmune disorder that your body attacks, the immune system attacks pancreatic beta cells and causes destruction of those cells, and the beta cells are the one that make insulin in pancreas. So type 1 is autoimmune disease. Due to destruction of beta cells. Mostly is genetics, type 1, and it happens in younger age, people younger than 20 usually, younger people. Type 2 diabetes, it occurs at older age, usually greater than 35 years old. And obesity is a major factor in type 2. So obesity as well as genetics. And diet, lifestyle, that all those contribute to having type 2 diabetes. This was a brief discussion of characteristics of each diabetic condition. We also have gestational diabetes in women that occurs in second and third trimester of pregnancy. And there are other types that is beyond the scope of this presentation. So we discussed the A1C levels for normal, prediabetes, and diabetes. We discussed type 1, type 2 diabetes, and in the future videos we're going to go more deep into the concept of how medication work to treat diabetes and different classes of drugs. Thank you. Please subscribe and like if you like the video so I can make more educational videos. Thank you.